This is the Halftime Show with Omar Adori on Pulse 95.
It sure is that time. It's the Halftime Show with Omar Adori. I'm your host covering everything sport, international and local. Hope you're having a blessed day wherever you're tuned in around the world, whether it's 95 FM, pulse95radio.com, our app, Sharjah Broadcasting Authority, or even if you're in the comfort of your own home watching us live on YouTube. Hope you're having a great day. And I'm really excited about today's guest because we often talk about prevention, and prevention over cure is the most common statement we hear in sports medicine. But how do we prevent one of the most common injuries in sport? When we talk about ACLs, when we talk about meniscus, we talk to Dr. Ahmed Abuab about, all the different injuries we're facing, but also a specialist in an orthopedic surgeon, a joint replacement and sports injury specialist is here on the Halftime Show today. So make sure you text us your questions on 4215 Ittasalat Urdu, or slide into my DMs at Omar Duri on Instagram and ask me those questions, because it's very insightful to have someone like this on the show to help those prevent the injury, which is normally something we only focus on after we've got it. So that's going to be on the Halftime Show today. Please make sure you tune in and let us know your thoughts on the only place to be at 3, the Halftime Show on Pulse 95.
This is the Halftime Show with Omar Adori on Pulse 95.
Salam and welcome back to the Halftime Show with Omar Duri. I am your host covering everything sport, international and local. Great day to have on the show today Dr. Ahmed Abuab from, the specialism of being an orthopedic surgeon, which is fantastic because we haven't had that on the show so far. And one of the things we hear often when it comes down to sports is injuries. But however, we don't always focus on prevention, and we focus more on cure when it's too late. Doctor, welcome to the show.
Thank you very much.
It's great to have you on. What I wanted to ask you today, Doctor, is how do we prevent common sports injuries, especially in the knee?
It's a big question. Prevention, basically, we always advise sportsmen and women that they should be prepared for that. Means that they shouldn't be involved in a game with fellows. Their level is high, beyond their level. They should always try to prepare themselves. They should be fit physically, means that they muscle point of view should be strong muscles. They should be they should have a long period of preparation. They've been on track since long time. They know their fellows. They know the pitch as well. If they're playing for instance, like football, they should wear proper footwear, of course. They should have what we call the reflexes of playing. For instance, if they lost their balance, if they will fall down, they should have the proper reflexes that they will not injure themselves. Because many injuries regarding the knees are because of awkward position, awkward movement. When someone who was trying to for instance, shoot the ball, and then after shooting, and he landed in an awkward position, he might twist his knee. So these things, that repeated movements, repeated training, repeated exercises, they definitely will prevent these. Sorry for saying that, but it's simple things that we forgot to do, but it can lead to quite awful lesions in the knees.
Absolutely. And something you mentioned there, very interesting, in terms of the surfaces that, a lot of the people that come in, the patients that come in with their knee injuries, is there a common pattern in whether it's AstroTurf, whether it's indoor, or whether it's grass? Do you find it more on one surface than the other?
Probably would be a surprise for some people, but playing in the sands, on the beach.
Okay.
Yeah, it is. Playing like football. Playing football on the beach. It puts a lot of loads on the knees, and for those who are not used to playing in the sand, they might get injured because the the knee and the foot are not stable while playing, because it's not an flat, it's not an even surface. So probably they might have higher incidence of injuries other than pitches. Of course, a bossy grass pitch as well. The others probably, indoors where it's hard surface, they might have a higher impact, higher load on the joints, on the back as well. But I don't think that there will be more injuries on the ligaments, on the joints, on the cartilage, more than the bone itself.
Can I ask you, doctor, when it comes down to those who maybe have started their playing or their the athleticism on the sand, has that helped people more on the other surfaces rather than the other way around? So, for example, if someone's used to playing on the beach and they've worked in sand for the first 10 years of their athletic career, let's say, has that reduced injuries when it comes down to grass or indoor?
Oh yeah, definitely. Usually the muscles are stronger. They have probably what we call, it's something that it's very technical. We call it proprioception, which is the sense of balance. There are certain receptors in the joints, and the ligaments, and the capsules of the joints that gives thousands and thousands of signals to the brain to tell us where our position. So these signals prevent injuries. So those people probably playing in the sands or on, surface which we are not used to play. Probably they have more. They are more prepared for playing the other surface.
Interesting. And when you've come across patients, does genetics really play a factor in how they get injured or how they heal from your experience?
Well, evidence-based, no. But probably someone who's mentally prepared, mentally strong, the recovery and the outcome of course better than someone who's really is not believing in that he will recover or he will return to pre-injury level. Yeah.
Interesting. So the mental aspect of the recovery is huge in the phase.
Huge impact.
Fantastic. Oh, there we go.
I'll give you an example.
Tell me.
Someone who has, if you heard about Ibrahimovic.
Absolutely. Zlatan,
yes. Yeah, the Sultan Zlatan, yeah. This guy, he injured himself at a late age, at 36. Usually other football players, professional players, at this age, they quit football. But he spent probably 5 months after surgery having rehabilitation of his knee, and he returned at a higher level. And now he came back from States to join AC Milan.
Yes.
And he's playing a pivotal role now.
Yes.
So it's fantastic with this guy.
Well, what's really interesting with you picking Zlatan Ibrahimovic out of a lot of the athletes out there is a lot of people see him as almost like a freak of nature, like someone that is genetically insane. But you say that's due to his mental capacity.
It's mental capacity more than anything else.
Wow. Yeah, there you have it. You've heard it from an orthopedic surgeon himself and a specialist. But coming up next, now those who don't get as active as they should, and those who maybe spend a lot of time sitting or driving in their car or at their desk, we're going to be talking about the doctor about the sedentary lifestyle causing stiffness, aches and pains in the knees on the only place to be at 3, the halftime show on Pulse 95.
This is the Halftime Show with Omar Adori on Pulse 95.
Salam and welcome back to the Halftime Show with Omar Adori. I'm your host, covering everything sport, international, local. Very interesting insight today on the show. We're talking about preventing injuries with the orthopedic surgeon himself, Dr. Ahmed, who is giving us a lot of information also behind the scenes as well. So you guys are definitely spoiled for choice if you're tuned in on the Instagram live at Omar Duri. Sorry about the connection issues if you are. Otherwise, you can head over to the Pulse 95 Radio YouTube channel and we are live. Okay, so Doctor, we were talking just before the break and it was really interesting that you highlighted Zlatan Ibrahimovic. For a lot of people who associate him with just being, a very genetically formed human being. But one thing you said which was really interesting was the fact that his brain and his mental state played such a huge role in his recovery. Does emotions play a huge factor when it comes to healing from an injury like an ACL?
Yeah, definitely. Like, when people understand what happens and understand what they have been through, and they understand that they should have surgery, and what's after surgery means rehabilitation, training, exercises. If they believe, deeply believe that they're going to recover from their injury and they will resume to their pre-injury level, they will succeed, of course. Most of the time they succeed, provided that the surgery has been done properly, of course. I've been facing a lot of cases like this, and some people, they come, they just want to do the surgery, that's it, and they are not aware about what will be after the surgery. They don't know about the rehabilitation. Those, they don't do well. They usually either the rehabilitation period will be prolonged, or they will always complain after the surgery. Although when we investigate, we find that everything was fine, everything has been done properly, surgery was good. But in contrary, those who strongly believe that they're going to make it, they have to recover. They want to, for instance, people who love playing football, soccer. Once the injury treated, like for instance in cruciate ligament or meniscus, they go back to their pre-injury level and they continue playing.
Excellent. And can you just tell us, for all the listeners, there are different grades of an injury. So when someone comes in for an ACL tear, what are the positive sides of, let's say, the grade 1, the grade 2, the grade 3? Which one is more severe, and how often do they normally take?
Okay. Cruciate ligament, what we call ACL, and anterior cruciate ligament, which is the most common ligament injured in the knee. We have another one, what we call posterior, which is the back of the knee, which is bigger but less injured. Probably nine cases out of 10 is the anterior cruciate. The rest is, of course, posterior. So it's a big bundle. It's like a cord, probably 10 millimeter, which is about 1 centimeter diameter, and it doesn't get injured or torn easily. It's very strong. So if there was a twisting injury of the knee, and if it is followed by 4 or 5 hours after the injury with knee swelling, substantial knee swelling, this might probably reflect having what we call a complete tear of the ACL. So the most common cause of having the knee swollen, substantial knee swelling, probably 2 or 3 times the volume of the knee, initial volume of the knee, it's probably a complete tear. Partial ACL tear, this is not necessarily associated with swelling, but it can cause pain for a couple of days, and it's difficult to diagnose, extremely difficult to diagnose, unless the patient goes for having the arthroscopy, which is the minimally invasive, what we call keyhole surgery. We stick a camera inside the knee. The simple sprains usually, at the name suggests, means that it's a simple injury, and usually it doesn't need any active intervention, no surgery. It just needs a rest, some painkillers, and rehabilitation program, including physiotherapy, strengthening the quadriceps muscles, and some proprioceptive exercise, which we should continue practicing.
And that would be a grade 1.
Grade 1, yes. Yeah. Grade 2, grade 3, yes. Yeah.
Excellent. Question here from one of our listeners, Murad. Why do some players never go back to their pre-injury level after an ACL surgery, or some take a long time to recover?
Okay, so what players, are they professional or professional?
Yes.
Unfortunately, this milieu of professional players, it's a closed environment, and usually either the clubs or the agents of the players doesn't want to say clearly what's happening with the player. Most of the time, it's not a single lesion, not a single injury. Probably they have multiple injuries. And if we go back to what we call there is a sort of cartilage which is covering the end of the bones. We call it articular, means the joint cartilage, articular cartilage, joint cartilage. This is difficult to treat whenever there is an injury that's part of the knee, of the joint. It's difficult to treat, and sometimes it goes undetected, and even the player quite often that he or she doesn't feel it. He doesn't feel that he has this lesion unless there was another injury, and then when we do MRI, magnetic resonance imaging, or he undergoes arthroscopy with the keyhole surgery, we discover this. So the fact that there are multiple injuries, multiple lesions, of course, have a great effect, negative effect on the recovery of the patients. Sometimes technical issue, means the surgery wasn't done properly, or from the beginning, the diagnosis wasn't done properly, misdiagnosis. Interesting.
Now, that's on one perspective when it comes down to the athletic side. For those that spend a lot of time sitting or like on a desk or driving for longer hours, what could you recommend for them to do to avoid issues with their knees?
Yes, it's a big issue. Again, I think the mental factor plays a role. If they're not keen to, because there's no excuse. If you're healthy, there's no excuse to practice some kind of sports. Even light sports, walking is a good sport. Biking is good. Swimming, doing some exercise at home. But they need to be a bit motivated to do this. Thank God that the new generation, starting from school, they are learning to practice. They're learning the value of practicing sports and what the effect of sports on our health. So I encourage them at least do half an hour walking, especially evening time.
Fantastic. Well, again, there's another perspective on the mental side of the game in terms of how much it involves on major injuries like ACL. Really interesting. Coming up next, though, we're talking about supplementation. Now, this is something that a lot of people have had and shared their views on, opinions on how to help be fitter, be healthier, but also from the orthopedic side of things, what can we do to help aid those injuries? Coming up next, right after the break, we're going to play you a track and we'll be right back. Here we go.
This is the Halftime Show with Omar and Duri on Pulse 95.
Salam, welcome back to the Halftime Show. Thank you very much for tuning in. And if you're just tuning in now and wondering what you've missed out on, we've got Dr. Ahmed in the studio here talking to us about one of the most common injuries, especially the ACL, which was really interesting. But what you missed out on, and you'll have to tune in and watch the show, because Super Mario and Gabby here at the Pulse 95 team do put up our shows. The whole episode will be on YouTube later on today if you're not catching us live on YouTube now. So, Doctor, a couple of things. We've had some great questions coming in regarding the impact of supplementation when it comes down to healing and when it comes down to the best for our bodies. We often hear mixed opinions on that. When it comes to supplementation, let's start off with preventing, like you said earlier, something I really like. You said there could be a number of things happening before the actual injury. How do we prevent that from happening? Is there certain supplements that you'd recommend to be taken, or is that based on nutrition? How does that go about?
Fortunately, there's a lack of evidence regarding supplements that might prevent sports injuries. There is a lot of controversy regarding this. Probably a well-balanced diet containing, of course, proteins, fat, and carbohydrates is well known, and there is evidence supporting this. Vitamin D is essential as well, because it helps us to absorb calcium in the body, and it plays a lot of in many activities in our bodies, immunity, in cardiovascular and fat metabolism, a lot. It plays a major role. So calcium is important as well. Vitamins, vitamin A, vitamin C, vitamin B complex, all these plays an important role. I think the modern diet that we've got daily contains a substantial amount and enough amount of these important elements. Probably 200 years ago, many of people they were lacking having a balanced diet. That's why they tend to have diseases like scurvy, which is deficiency of vitamin C, and so on. But regarding what we call, like we discussed earlier about glucosamine and collagen, unfortunately, I'm speaking evidence-based. Unfortunately, there is no evidence supporting that these substances will prevent having injuries precisely regarding the cartilage, the articular cartilage, which is the cartilage covering the bone ends in the joints.
Fantastic.
You will see it over the counter a lot. Everywhere where you go, you will see the glucosamine, chondroitin sulfate, and collagen. But there is no evidence, there is no single evidence supporting that these substances, these medications will help heal or even prevent the lesions. I'm sorry to say this. I know that many people will get frustrated, but there is no evidence supports, medical and scientific evidence that supports this.
There you have it, Dino and Murad. We answered your questions in one answer as the doctor hit it. Doctor, there's also a couple of things as well regarding the nutritional side of things. As soon as you said, a naturally balanced diet will always work better than, the things over the counter, so to speak. What's your take on, and I know Regad asked the question, what are the best meals that help him lose weight and gain muscle? But I will add to that as well, which is quite a broad question. That's a whole segment in itself. My question is, things like turmeric and ginger, how vital are they in including in our meals to be able to help with, that balanced diet?
I'm sorry, but I can't answer. It's beyond my competence, because it's really something related to diets, very specific questions. I don't think that I'll be able to answer regarding ginger. We know that we are using ginger in our traditional food, and our grandma, granddad, they know that it's a very important element that we add to our food, and since it's we've been using this 100 years ago, so I'm quite sure that it has a beneficial effect on our body. But scientifically speaking, I cannot answer this question.
Very interesting. No, absolutely no problem. The thing that a lot of people talk about now is sources and practices, and when it comes down to the different opinions, when you assess someone as they come in, let's say having suffered like an injury like the ACL or even the PCL, as you mentioned earlier, is there a process to when they should see you? And I ask this out of personal experience, because sometimes when you suffer such a big injury, normally you're advised to take some time to let the swelling reduce. But if you go, our instincts when we get injured is to directly go to the hospital. Is there a waiting period that we need to wait before we go in? Because things like the MRI and the X-ray won't really be significant if we're still swollen in that manner. What's your take on that?
Yes, I think it's better to go to seek medical advice whenever there is an issue while practicing swelling or inability to bear weight, means walking or stepping on the foot. These are, I think, enough evidence that tells you that there is something wrong is with my joint. So swelling, especially swelling, or for instance, feeling the knee is wobbly. It means that there's something happened. Means that probably the ligament is affected. So, or unable to make your knee straight, put it straight. If it is, a little bit bended and you cannot put it straight, this is a very important sign that you need an urgent advice, because it indicates that most probably there is meniscal injury in this case. So feeling the knee wobbly, feeling the knee, noticing the knee become swollen, or unable to straighten you make your knee straight, this indicates that there is a major injury happens. So I think it's better whenever you feel these signs or you're having these the symptoms of pain or swelling, better to seek advice. But first of all, take rest, put ice, and then go. It doesn't mean that you go on the same minute, same hour, but better to seek, even after a day or two.
Great. Natalie's asked a question here on the Instagram Live. Hey, Omar, I have a question for the doctor regarding joint hypermobility in the knees. What is the most advisable way to treat such conditions, knowing that the pain is unbearable sometimes?
Okay. Hypermobility, it's most of the time it's a generalized issue. It means that it's hypermobility affecting not only the knee, it might affect the elbow, it might affect the shoulder, and that's why we see some people having frequently dislocating the shoulder. We quite often this seen in our practice, and if it is, and most of the time it do cause pain, but most of the time it doesn't cause pain. Provided that the patient is not practicing heavy exercises or heavy sports. But you need to seek advice. You have to counsel. You have to counsel with them. You have to do. You have to visit your orthopedic surgeon, especially those who are specialized in sports injury. But most of the time, what we call the hyperlaxity is affecting many joints, especially the shoulder.
Fascinating. Okay, so we've got one more segment coming up, Doctor. I knew it was going to fly with you. I want more time. We're going to answer those questions. Keep those questions coming in, everyone who's tuned in, or text us on 4215 Etisalat or do. We're going to take a quick break and we will be right back after this. Enjoy.
This is the Halftime Show with Omar Adori on Pulse 95.
Salam and welcome back to the Halftime Show with Omar Adori. What a show we've had so far for you. There's been a lot of insight today, a lot of interesting things that Dr. Ahmed has mentioned. And thank you all for asking, sending in your questions. Shout out to everyone who's tuned in. SA, Terry, Amol, AWFL, Hidayah, of course, our very own Hidayah Masood, Fahad, Natalie, RD, Reyes. Wow, I'm trying to get through everyone. Reem, Dino, Murad, Reghad, Big Hass, our very own Big Hass from Yalla Home, Fahad, Rauda, Dinner with Flo. I hope I haven't missed your name so far, but thank you very much for everyone who has connected with us and sent in some great questions, by the way. One of the questions we had sent in is from Terry saying, what sport causes the most injuries, doctor?
Well, probably the American football and rugby.
So I'm sure Terry will be happy with that. She's a big South Africa rugby fan. RD Reyes said, I had an injury in my ankle 1 year ago and it still hurts when I do workouts. Although I did physical therapy, what do you advise, doctor?
First, what injury? Could you describe what happened exactly? Is it that the foot turned to inside or outside? If it turned to inside, which is most common type, there is a ligament which is usually affected, which is in the outer part of the ankle. Usually it's injured. So if it is after still hurting you after a year of rest, having physical therapy, and you didn't improve, I guess you need an MRI, and before that you have to see, of course, a sports specialist, sports injury specialist, or an orthopedic surgeon, of course. He will examine, he will do an X-ray, and he will ask for an MRI because we have to check for the integrity of the ligaments and the articular cartilage as well. It's very important. But most of the time that you didn't undergo a comprehensive program of rehabilitation of the ankle, and hopefully that there is no lesion within the knee which is still untreated.
Fantastic. Last question, I promise, doctor, before we let you go. When we do get injured, what's the correct call to action?
Do nothing, just take rest, apply ice. You have to immobilize the joint or the limb, and of course you have to go to the emergency, of course.
Fantastic. Doctor, thank you very much for your time. I've really enjoyed having you on. I'm sure there's a bunch of questions we could ask you as well, but I really appreciate you taking the time out to visit us here in Sharjah on Pulse 95.
I'll be honored, Omar. I'll be honored to be among you. If you want me to come back, I'll be more than happy.
Thank you so much. And there you have it, folks. Remember, you can catch us every Monday, Wednesday, and Saturday, 3 to 4, on the only place to be at 3, the Halftime Show on Pulse 95.
If you liked this episode of the Halftime Show, drop a like and subscribe.
95.
Be sure to follow us on Instagram for all our daily updates and top stories. Pulse